How you doing there, student? Take a chair right there. So I'm going to teach you how to be a medical scientist or evaluationist or a researchist. Okay, so it's good to have a clicky pen. Click, click, click. Yeah, it's good to have one of those, see? See, in this kind of a business, you have an audience and they want to be relaxed. Oh, yeah. If they want to have tingles and they want to feel good. That's good. Make sure you take notes. There'll be a quiz at the end. I don't mess around. You have research papers, documents. If you need to make a copy, we have a copy machine. Yeah. We have medical forms for this hospital. We have diagrams for the different parts of the body and what ailments the patients have. Make sure you write that down. Like I said, there will be a quiz. So this is a sample of the forms. We have. We want to make this as realistic as possible, because a lot of our watchers and subscribers expect the best. Oh, what's that question? You have a question? Oh, do you want to do sleep therapy? Yeah, we do sleep therapy. Atmosphere would be different. It would be like a blue. Each color represents a different kind of instance. Like if it's red, they have an eye problem or something serious. So the whole area here would turn into a red zone. Some of the files we have a lot more. Really piles up. But we try to keep the patient's information. Can you type? How many words a minute? 60? You got to do more than that. You got to do like 120. You don't go too fast, then you start to get pain in your wrists, and then you have to wear a so-called brace kind of thing. Try to keep the documents in order. Patients like that. Our medical director is very strict here. Who is the medical director? Me? You're looking right at him. Sometimes the medical director supersedes whatever the doctor is working on. So to do this job correctly, make sure you know your tingles. Make sure you know your sound of stuff. You take x-rays. You take, you may take like, That's very soothing. We listened to that a couple of times. It's very soothing. We also have a new stuff here we picked up the other day. It actually simulate cracking the neck. Yeah, you can crack your neck. This is another way to crack. Create like a cracking effect. Yeah. We do have a video you can watch, or you can just follow along. Okay. We also do cranial. Cranial involves the nerve, so it's a cranial nerve examination that sets up the nerves. You know, most likely you would go like this, like this, like this. So basically, the patient would have to keep their head moving. If they can't keep them moving, then there's a problem. Yeah. Or we can go like this. Flash sliding or fast moving objects don't bother you, do they? Or they don't? Slow. Fast. It's a good workout. Sometimes we would ask the patient, what color did you see? And what did you see? And that's very good for them to observe and try to figure out what they did see, if they were paying attention. We do smell, taste, sight, visual, hearing. Yes, we use tuning forks. Each tuning fork is 512. Two of them together, it's really good. It helps to soothe you down. If somebody's really angry, you can calm them down. Calms the mind down, tones and different frequencies. See where I'm placing it on behind the ear? Behind the ear is very sensitive. That's where you use magnets. Say you had a toothache, as you would put the magnet right behind it in the ear. There's certain pressure points that take care of certain things. And what you do is you're pushing the pain away. Well, it's good to learn that, because we do a lot of dental, and we use magnetic therapy here. We actually use real magnets, not the black ones. The other ones. The ones are expensive. Well, the black ones don't have enough strength. They're made differently. The other kind, they are stronger. You'll be very careful. Anything can relieve this. Well, and now we know that that's this is aluminum. You need metal. Let's see. Yeah, that's strong. Yeah. You put that on a vehicle door, and you put something on there, it'll stay on there. It won't come off. Oh yes, this is called a tuning fork. Yes, and this is what you use for testing reflexes, elbow, the knee. Good medical tool to have. Are you taking notes? Good. What did I just use? I was making the noise. Okay, that's good. That's right. The tuning fork. What hertz was it? Don't tell me you didn't write that down. You gotta write it down. Nothing that wasn't a quiz. You would have problems. Then we had different parts. We have fingers, eyeballs, ears. Sometimes we have teeth. Where we show the patient, what we're doing, and stuff like that. So you should come well prepared. Taking care of the eyes, the ears, stuff getting to the eye. You can brush away the eye. Sometimes there's hair particles dropping into the eye. All sorts of things drop into people's eye. You have to be careful. Otherwise, you'll have to get the tools out and take care of it. Yeah, we wear a lot of gloves here, so we'll supply you with gloves. You wear any color gloves you have, purple, green, whatever you can get. Black. I like black. It's hard to get. But, see, this is what happened. You got a bit. No good no more. Make sure you put things in the trash. Otherwise, we'll have stuff all over the place. Okay. Yeah, the gloves don't last too long. Oh, okay. We also have disinfectant. I'll show you how that works. What works best. What people like. Okay, so every time you put the gloves on, so make sure it's really shaped up. Put a little dab on your gloves. Then you do like this to dry it out. Now, I'll tell you a secret. A lot of people want you to go close up to the screen as far as you can. Like really in their face. But hey, do the best you can. Okay. But you got to be comfortable as well. If you're going to work on their teeth, work closely on their skin. It is recommended that you get into the habit of wearing magnifying glasses with the light. They come in different sizes. Goes all the way up to 5X. And the lowest is like 1.5. Next one is 2.5. And after that, it's 3.5. It's pretty strong. Look pretty cool, huh? It's like a blue light. Another way you can get around that is make sure you get a pair of these glasses. They're clear. They're neutral, so they kind of blend in with what you're wearing. We'll give you some of these. We have a lot of these. The pen light. And the magnifying glass. If you can't see things up close, you would use this. Okay. Do you have any questions for me before you take your quiz? Oh, you're all good? That's good to know. Oh, you're already taking your quiz. Oh, you didn't know that. Yeah, you paid attention, so you know what was happening. That was your quiz. See, they come in here and they fool around, but you didn't fool around. You actually did what you had to do, and that's good. So we're going to end this, and thanks again for watching. This is a skin analyzer. We analyze the skin. It needs to be within a certain ratio, between 75 to 100%. See what you are. 77, that's not bad. Good. Again, thanks for watching. Do subscribe. Make the channel grow. Okay? Thank you very much. Who am I? I'm Dr. Tinkles, also known as Albert, the medical director. Bye for now.